Hello, everyone. Back again tonight to cover a rather important topic. My goal is to help reduce maternal deaths, and we've had some occurrences occurring in Congress that may have some major impact on the outcome of pregnancy. We talk about insurance. I've done that in earlier videos. But on February 25th, the Republican controlled House of Representatives passed the budget resolution in which they are wanting to have $4.2 trillion tax cuts. And as a part of these tax cuts, they are asking the House of Representatives, particularly one of the committees that has the jurisdiction for Medicaid and Medicare. They are asking that particular committee to cut $880 billion as the start, billion dollars. Their goal is to try to get $2 trillion of tax cuts, which means that we're going to end up with a budget deficit of another 2.2 trillion after you do that $2 trillion of tax cuts. But what's interesting is that $880 billion is almost half of the tax cuts are being directed toward this one particular committee that is overseeing Medicare and Medicaid. And it's thought that it's just not possible to be able to come up with this amount of tax cuts without it affecting Medicaid. So it's quite a quandrum that we find ourselves in. So let's take a look. I think you're going to be a little bit surprised when you look to see who uses Medicaid. Most people think Black folk are the main users of Medicaid, and that is just not the truth. This is the data from the Kaiser Family Foundation. And this is data for 2023, but keep in mind that this is reflective of those who are on Medicaid for years. White folk use Medicaid at twice the rate of Blacks. Hispanics using Medicaid at 1.5 times that of Blacks. So you're looking at whites at 39.5%, Hispanic at 29.9% of recipients of Medicaid. Blacks are number 3 out of 5 different racial groups with 18.9%, followed by Asian Pacific Islander Native Hawaiian at 4.7%. And you would think the American Indian would be using Medicaid at a higher rate, but only 1%. And so the population that's going to get smacked the most is going to be the white population. The other thing to keep in mind is that 41% of all of the babies born in 2022, 41% of those births were covered by women who are covered by Medicaid. I'm keeping this up so y'all can take a look at this so you can see reality and let this information sink in. This is who uses Medicaid, y'all. A little surprising, a little surprised, a little shocked. This is the real deal. This is the facts. Medicaid disruption is going to hurt a lot of people. It's going to affect maternal mortality in the United States, which is already at the highest level for any developed country in the world. We're the last when it comes to maternal mortality for developed countries. And this is going to impact it even more. The other is the other persons who are using Medicaid are children, also disabled individuals, the elderly. So when we think about, okay, when I go to a hospital, I'm trying to get coverage for my care, Medicaid also supplements hospitals. It pays for the stay of elderly folks in nursing homes. It also pays for those who are in group home situations. So it's going to affect many, many people. So, what are we going to do about this? First of all, keep in mind this is a resolution that has been passed by the House of Representatives. It needs to be adopted by the Senate. And so you can have something to say about this by contacting your congressperson, your senator, and ask them to please hold up on this, okay? Once it is adopted by the Senate, they then have to write legislation to be able to incorporate these tax cuts. And so don't think that you don't have anything to say. You have something to say. This is your taxpayer dollars at work. So we need to be active about this. I'm going to share with you 5 calls, which is an app that you can put on your phone that makes it very easy for you to identify your congresspeople and to be in touch with them and let them know that we need this to be able to protect mothers and babies. We need this to be able to protect your grandmother or your grandfather or your elderly auntie or uncle who may be in a nursing home situation. Okay? So we need to be making our voices be heard. And 5calls.com is helpful for it to give you everything you need to say, everything you need to do around this. Doesn't take but really doesn't even take 5 minutes for you to call your congressperson. They already have the text for you to say when you call them. You need to give your phone number, your name, your address so that they know that you are a constituent in your particular state. The other thing to keep in mind as well is I want you to listen to Representative Al Green out of Texas, who got censored because of his adamant vocalization about the fact that there was not a mandate to cut Medicaid. He's putting things on the line, standing up, and I want you to hear what he had to say. So, y'all, we got to act. We have to act for the health of mothers, for the health of babies, for the health of children, for the health of the disabled, for the health of the elderly. Just takes a few minutes, okay? Y'all have a good night. Take care now. Bye-bye.